think that, I know Philippe said over and over that congested IVC is like a prerequisite. And if you don't have that in terms of VExUS, like do not pass go, do not collect $200 kind of thing. That being said, I think especially as you're gaining practice, it's useful to try to collect other waveforms because sometimes they can act as a nice check on each other. And if I have really discordant findings, I'm going to make sure that I really believe my findings, right? Am I actually seeing this IVC properly, or is there some lateral translation that is tricking me into thinking that it's collapsing, for example, or is there intra-abdominal or intrahepatic pathology that's confounding things? The other thing that you mentioned specifically with the portal vein is that there's literature to show that you can get portal vein pulsatility, not reversal of flow, but pulsatility in normal, thin, healthy patients. So that certainly could be, you could have a plethoric IVC, but a collapsible IVC rather, and a pulsatile portal vein in someone who is totally healthy. But I think in general, you want to see a congested IVC before you go further. But do your waveforms, make sure you believe what you're seeing. If you don't believe, then take everything with a grain of salt, I guess, with regards to your scans, because there's caveats to all of these waveforms, as we've talked about.
Okay. Also, I was going through your cases, Dr. Viskar. I was just browsing through Twitter, and I saw where you shared a case of a very young patient who received fluids in the ED, and the IVC was big, and the portal vein was pulsatile after just 1 liter of fluid or so. I think William was commenting that we don't know how these waveforms behave immediately after fluid administration. Totally. I found that very intriguing. Totally. I don't know, if you had a chance to follow up.
I did. I think COVID hit, so I didn't see her in person, but I followed up with her remotely, and she had an echo, and everything was like stone cold normal, and she was totally fine. So I assumed that was like the transient effect of like the liter of fluid she had, which is kind of crazy to think about, that you could generate pathology so easily.